So now we're going to look at the supportive structures of the talocrural and the subtalar joints. So the talocrural joint is made up of the talus, tibia, and fibula, and the subtalar joint is between the talus and the calcaneus. So if we start on the lateral side, there's three main ligaments that support these joints. The first one is the anterior talofibular ligament. That goes from the anterior aspect of the lateral malleolus to the neck of the talus. All these ligaments are going to be tight on inversion. However, this one is also going to be tight with plantar flexion. Next, we have the calcaneofibular ligament. So that goes from the apex of the lateral malleolus to the lateral tubercle of the calcaneus. So that's just behind the peroneal trochlea. And then we have the posterior talofibular ligament, which goes from the posterior aspect of the lateral malleolus to the lateral tubercle of the talus. And that's going to be tight with dorsiflexion. Next, we can look at some of the medial ligaments of the ankle joint. So we have the deltoid ligament, which is actually four separate ligaments, and those are going to be tight with eversion, and they can also be tight with certain motions that I will mention. So first you have the anterior tibio-talar ligament, so that's going to go from the medial malleolus to the neck of the talus, and that will be tight with plantar flexion. Then we have the tibio-navicular ligament, which goes from the medial malleolus to the navicular tubercle, and that's going to be tight with plantar flexion. Next, we have the tibiocalcaneal ligament, which goes from the medial malleolus to the sustentaculum tali of the calcaneus. And lastly, we have the posterior tibio-talar ligament, which goes from the medial malleolus to the medial tubercle of the talus. And that is going to resist dorsiflexion. And that is actually the thickest of all of the bands of the deltoid ligament. You also need to remember that we have the anterior tib-fib ligament and the posterior tib-fib ligament around this area. We also have the inferior transverse ligament of that distal tib-fib joint. And there's also, in the posterior aspect, a medial talocalcaneal ligament of the subtalar joint.